So Chapter 9 continues with the cardiovascular system, looking more specifically at the blood vessels and the circulation. And as you saw in that video from Crash Course, there's a lot involved with blood vessels beyond simply that they are a conduit. They actually have muscles in them, or they have valves, and they also have the ability, at least at the smaller level, like in capillaries, to allow certain things out of them or into them. So we're going to be talking about all of these different properties of the blood vessels. So you're going to need to be able to distinguish between pulmonary and systemic circuits, which you should be able to already do, really, and identify the difference in afferent versus efferent blood vessels. We'll talk about the different types of blood vessels, the structures of capillaries and the functions when it comes to exchange. And of course, the level of capillaries is the systemic part, really. We'll describe the venous system, talk about the distribution of blood in the cardiovascular system. So first of all, blood vessels conduct the blood between the heart and the peripheral tissues. Again, you already know these terms, arteries versus veins. Arteries carry blood away from the heart, so you can remember arteries, away, both begin with A's. And these are your efferent vessels. So anytime you see the term efferent, it does mean away from something. When I used to teach a course in water quality, we used a term called effluent. Okay, and effluent also meant away from something. So it was water being sent away from, say, a process. So this term EFF, whenever you see it, does always represent something moving away. Okay, veins carry blood to the heart, and they are called afferent vessels. Afferent. The capillaries are where the exchange occurs between the blood and the tissues. So they're interconnecting the smallest arteries with the smallest veins. And we'll talk about those connectors as well. Generally, we talk about two circuits, the pulmonary circuit and the systemic circuit. The pulmonary circuit going to and from gas exchange surfaces in the lungs, or the systemic circuit is to and from the rest of the body. Now, sometimes you'll hear other people, and even myself, refer to maybe other circuits like within the heart itself, the heart tissues, and then we talk about coronary, or we can talk about the lung tissues itself. But when we're talking about broad categories of circuits, pulmonary and systemic are the two we talk about. Okay, the circulation pathway through the circuits. We have the right atrium, which is the entry chamber of blood into the heart. It collects blood from the systemic circuit, and it goes to the right ventricle, and then to the pulmonary circuit. Hopefully you remember this. And then the pulmonary circuit, we have the pulmonary arteries that are leaving the heart, and they go to pulmonary capillaries and to, of course, in the lungs, and then pulmonary veins come out of the lungs. And they will come back into the heart. So the left atrium then receives blood from the pulmonary circuit through what veins that I just mentioned? Pulmonary veins. And that goes to the left ventricle and then to the systemic circuit. And as the blood leaves the left ventricles to the systemic circuit, where does it go through? What's the big vessel? The aorta. Okay, the systemic circuit, we're talking about the systemic arteries to the systemic capillaries, and that's where exchange occurs with the peripheral tissues, and then eventually to the systemic veins where blood comes back to the heart. Okay, so this diagram shows the basic differences in the pulmonary circuit and the systemic circuit. Okay, so again, remember, pulmonary circuit involves the lungs. Systemic circuit involves the other tissues. So which chamber of the heart receives blood from the systemic circuit?
Right atrium.
The right atrium, good. And we'll talk about these other vessels in more detail. Okay, here is the basic structure of the vessels. We see three basic layers of arteries and veins. The tunica intima. This is the innermost layer that you see in this diagram. We have endothelial cells that have some connective tissue with elastic fibers. In the arteries, the outer margin has a layer of elastic fibers, an internal elastic membrane. And do you remember what he said in the video the endothelial cells are? What type of tissue?
Simple squamous.
Yeah, simple squamous epithelium or squamous, however you want to say it. Then we have the middle layer of the tunica media. It has concentric sheets of smooth muscle. Contractions here will cause a decrease in the vessel diameter. This is what we call vasoconstriction. This is one of the ways your body prevents itself from losing too much blood, in addition to, say, platelet plug and coagulation of blood. Relaxation causes an increase in vessel diameter or vasodilation to allow more blood into certain areas. And it's separated from the tunica externa by an external elastic membrane. Okay, the tunica externa, also you'll see this in some books listed as the tunica adventitia, is the outermost layer. It has a connective tissue sheath. In the arteries, it has collagen and elastic fibers. In the veins, it's generally thicker than the tunica media. It contains a network of elastic fibers and bundles of smooth muscle cells. And the tunica externa anchors the vessel to the surrounding tissues. So it doesn't just kind of hang loose in there. This diagram shows you that the arteries and veins do indeed have all those layers, but you see some dramatic differences between the artery and vein. What's the first thing that stands out?
The shape.
Which one?
The shape of them.
Yeah, the shape somewhat. I mean, for the most part, hopefully you saw this in laboratory. I had those slides setting out for you. But you're going to see generally a larger lumen of the vein. Okay, and so the shape looks a little more irregular sometimes, but sometimes that just has to do with that particular cut. Okay, and it's not under pressure when you're looking at it in the slide. What do you notice about the wall of the artery?
It's thicker.
It's thicker. Why do you think that? What's causing that wall to be thicker?
The muscle layer.
What is this material in the middle?
Myocardium.
Well, smooth muscle. Okay, smooth muscle. And why would you have more and thicker smooth muscle in the artery wall?
The pressure.
It's under a lot of pressure. Okay. And plus something we'll talk about here in a little bit is the way that we move blood in a vein has more to do with the skeletal muscle pushing on that vein as you're moving around. So let's look at 5 general blood vessel classes, and we're going to start with the arteries. You have elastic arteries, you have muscular arteries. The elastic ones, these are large vessels that are close to the heart that stretch and recoil when the heart beats. This includes the pulmonary trunk, the aorta, and its branches. Why would the vessels closer to the heart need more stretch and recoil? And again, kind of similar to what we were already talking about. We got a lot of pressure coming out of the heart. Okay, as we move to the muscular arteries, they're medium-sized arteries. They distribute blood to the skeletal muscles and internal organs. So we may have a little less pressure, but we might need the muscles to help with that movement at this point. Okay, now we're going to go to the smaller arteries, and they're called arterioles. It has a poorly defined tunica externa. The tunica media is only 1 to 2 smooth muscle cells thick. So now we're getting closer to the peripheral tissues, closer to the capillaries. And now we're at the capillaries. These are the only blood vessels that allow exchange between the blood and the interstitial fluid. We don't have this movement out of the arteries and the larger veins. So we have very thin walls that allow easy diffusion. We pretty much have a layer of endothelial cells that allows that movement in and out. And we'll talk about the different types of capillaries in a little bit. Okay, now we're moving to the other side. Now we're on the other side of the capillaries. We now are going to deoxygenated blood, kind of draining off the tissues. So we move to venules, which are the small veins. The ones that are smaller than 50 micrometers do not have a tunica media, and they look very similar to expanded capillaries. So their purpose is to collect blood from the capillaries. And then we move to the veins, the medium-sized veins, which are 2 to 9 millimeters in internal diameter. They have a thin tunica media. They have smooth muscle cells and collagen fibers. And the thickest layer is the tunica externa, and it has longitudinal collagen and elastic fibers. Then we move to the large veins that have all 3 vessel wall layers. It has a thin tunica media that's surrounded by the thick tunica externa. And large veins include the superior and the inferior vena cava and then the tributaries. So they are just large veins. And the superior and inferior vena cava feed into what chamber? The right atrium. Okay, this is a good diagram to remember. This is also a good table to review for the next exam. But it just summarizes what we've already talked about. Okay, so why might a blood vessel have large vessel walls? Well, it might contain small arteries and veins for nourishment. And in this case, we call it a vasa vasorum, which is vessels of the vessels. You know how we've talked about all along that these organs, even like the lungs and the heart, have to have their own vessels that supply them with oxygen and nutrients. Well, some of your large vessels also have a lot of tissue themselves that needs to stay alive and needs to stay nourished and needs to have its own oxygen. So some of your larger vessels have their own vessels. So vasa vasorum. Okay, so working your way from the heart, what do we call those large vessels coming out of the heart? Arteries. And arteries go to arterioles. Arterioles go to capillaries. Capillaries go to venules. And then venules go to veins. And yeah, in between you have large and small, right? Okay, let's talk about capillaries then, because they are quite important, because again, this is where the actual exchange occurs of the gases and we also basically feed the tissues. So your typical capillary is small. It's a tube of endothelial cells. It does have a basement membrane, but it does not have a tunica media and a tunica externa. The average diameter is only 8 micrometers, and that is about the size of a single red blood cell. That's how small they are. So they only allow like 1 blood cell through at a time. There are 2 types, continuous capillaries and fenestrated capillaries. The continuous capillaries, the endothelium is a complete lining. That's why we say it's continuous. We find these throughout the body and all the tissues, but not in the epithelium and the cartilage. So where might you find epithelium? If you remember from 168, skin. Okay. It permits diffusion of water, small solutes, and lipid-soluble materials. It prevents loss of blood cells and plasma proteins. And it does have some selective vesicular transport, however. It has specialized continuous capillaries in the central nervous system and the thymus that do have specific endothelial tight junctions. And by having tight junctions, it basically regulates certain things going in and out, so we have regulated permeability. So again, these specialized continuous capillaries are in the central nervous system and the thymus. You've heard of the blood-brain barrier before? Okay, fenestrated capillaries. These contain windows or pores that penetrate the endothelial lining. It permits a rapid exchange of water in larger solutes. We'll find this in the choroid plexus of the brain, hypothalamus, pituitary, pineal, thyroid glands, the absorptive areas of the intestinal tract, kidney filtration sites. So some of these sites make perfect sense because you want to have good continuous flow. You know, definitely the intestinal tract and the kidneys, you can imagine. There is also such a thing as sinusoids or sinusoidal capillaries that look kind of like fenestrated capillaries that are flattened and irregular in their shape. They often have gaps between the endothelial cells. The basement membrane is thin, though, or absent compared to some of the others. They do permit more water and solutes, like plasma proteins, to be exchanged. And these we find in the liver, in your bone marrow and spleen, and a lot of the endocrine organs. So usually we find all of these capillaries in capillary beds where they're interconnected. And they are in between arterioles and venules, where the oxygenated blood with nutrients is coming in from the arterioles and then feeding into the venules after the exchange of gases occurs and the nutrients. And the capillary bed can be supplied by more than one artery. Multiple arteries are called collaterals. And this helps some cases where you might have certain areas or vessels to get clogged for one reason or another or damaged. Then you have collaterals that can take over and still allow exchange of the blood. They're fused before giving rise to the arterioles. And fusion is an example of the arterial anastomosis, which is just joining of blood vessels. Again, as I was saying, it does allow for continuous delivery of blood to the capillary bed, even if the artery is blocked or compressed. It can be bypassed by the arteriovenous anastomosis that connect the arteriole to the venule. And in this case, it's regulated by your sympathetic nerves. You also have made arterioles or precapillary arterioles, which are beginning segments of connection passageways. They have smooth muscles that change the diameter of the vessel, and this way you can adjust flow rates through those areas. Thoroughfare channels exist. This is the most direct passageway through the capillary bed. You have precapillary sphincters, which are bands of smooth muscle that contract and relax that control flow through the bed. And you have cycles of contraction and relaxation through these areas, which we call vasomotion. So this picture shows you what a capillary bed looks like. And it shows you all of these different components we were just talking about. The anastomoses, the sphincters, the thoroughfare channels. Okay, so what were the two major types of capillaries we talked about?
Continuous.
Okay, continuous and fenestrated. Okay, I want to talk more about the veins now. We'll talk about pressure and blood flow through the veins. So blood pressure in the peripheral venules is less than 10% of that we see in ascending aorta, which is your largest artery. And therefore, there's other mechanisms that are going to be needed to maintain the flow of blood through the veins because they are fighting gravity in many cases. So we have valves, as we mentioned. So these are folds in the tunica intima that project from the vessel wall. They point in the direction of blood flow. And by doing that, when blood tries to go back through it, it closes the valves when it pushes back on those particular flaps of the tunica intima. So that ensures the one-way flow. And also contraction of skeletal muscles around the blood simply just pushes on the vessels. So every time I move, I'm helping with the venous flow. So contraction of the skeletal muscles squeeze the veins. The valve permits the blood flow in one direction. It keeps you from having backflow because you don't want to mix oxygenated and deoxygenated blood. And if the valves do not work properly, which does happen, blood can pool in the veins that causes distension and many other effects, from a mild discomfort to cosmetic problems, like in varicose veins, which we see a lot at thighs and legs, or distortion of adjacent tissues, as in hemorrhoids. Okay, so this picture shows some of these veins and that valve orientation as we were just discussing. And you can kind of understand that if you had backflow of blood, that it would just naturally push down on these folds and close it. Now the distribution of blood is uneven throughout the arteries, veins, and capillaries. Your systemic venous system has about 64% of your total blood volume. And of that, about 1 liter is in the venous networks that carry blood from the digestive organs to the liver. So it actually acts as a blood reservoir. The systemic arteries have about 13% of your total blood volume. The remaining blood in the systemic capillaries and the heart and the pulmonary circuit. But again, the systemic venous system has about 64% of your total blood flow. And that's quite a lot. This graphic shows that breakdown. think I'm going to stop right there, and we'll talk about venoconstriction next time and some of the ways that we regulate blood flow.